Welcome to the AUA Inside Tract Podcast. Today's Inside Tract Podcast is part of the Meet the Subspecialties series and is brought to you by the Residents and Fellows Committee. Dr. Juan Andino, Andrology and Male Infertility Fellow at UCLA in Los Angeles, California, sits down with Dr. Raevti Bole, Andrology and Infertility Fellow at Cleveland Clinic in Cleveland, Ohio, and Dr. Sarah Vij, Assistant Professor of Urology and Andrology and Infertility Fellowship Director at the Cleveland Clinic, to explore the subspecialty of andrology and male infertility.
Hello, my name is Juan Andino. It is my honor and pleasure to host our podcast today, Meet the Subspecialties, Andrology and Male Infertility. Good morning, good afternoon, or evening, depending on where you're listening to us. And welcome to this episode of the AUA Inside Tract Podcast. I could list a number of accomplishments for our two guests today, but I'm very excited to get our conversation started, so I'll be brief. To highlight a diversity of opinions and perspectives, we have Dr. Raevti Bole, this year's Cleveland Clinic Andrology and Infertility Fellow, and Dr. Sarah Vij, who wears many hats, but most importantly for this topic is the Andrology and Infertility Fellowship Director at the Cleveland Clinic. My disclosure is that in addition to being today's host, I'm one of two Andrology and Infertility Fellows at UCLA, and it is fair game for any of the questions to be directed back at me today by our panelists. So let's get started. Dr. Vij, I'll ask you first, what led you to pursue a career in andrology and infertility?
Sure, that's a great question. So I was fortunate in that early in my training and residency, I had exposure primarily to infertility, which a lot of residents I know don't, and got some, experience with microsurgery pretty early on. And it always sort of stayed on the mind from that point. And I noticed that when I did clinic, I wasn't sort of checking the clock, waiting for the day to end. And I think clinic for many surgeons is sort of the less enjoyable part of the job. And I found that I liked it. I liked talking to these young, healthy patients that were trying to get pregnant. So as I kind of got further along, I learned that there are other, parts to andrology, primarily sexual health, that came along with it. And I really enjoyed all of that. So it just seemed like a good fit.
That's excellent. And I think, a lot of folks who are in this space would echo those same sentiments. Dr. Bole, how about you? Anything else that really kind of attracted you to the world of andrology and male infertility?
Yeah, absolutely. I completely share all of those sentiments. Just like Dr. Vij said, it is a little unusual probably for a surgery resident to enjoy clinic. And that was something that stuck out for me as well. And in addition to that, I had some really great mentors in residency who let me spend time with them doing research projects and in the OR. And I happen to enjoy microsurgery as well as prosthetics, and realized that this was a field where you could do both.
Excellent. And speaking of, that early exposure and having mentorship, can you both tell me a little bit about what this structure looks like in terms of your clinic, operative time, research time, particularly from the perspective of, the Cleveland Clinic Andrology and Infertility Fellow?
So in terms of how my time is spent, and there are three other faculty who are involved in mentoring the fellow and training the fellow. But in terms of my practice, I essentially have 3 days of clinic a week, a day of OR a week, and essentially a fifth day that's administrative and research time.
Mm-hmm.
My practice is predominantly infertility, so it tends to be a little bit less surgically heavy than some of my colleagues who also are involved in training Dr. Bole and other fellows. So we craft the fellowship in terms of where the fellow spends their time based in part on their primary interests. So they spend a little bit more time with me if their interest lies more in the fertility world, and a little bit more time with Dr. Bayach, Dr. Park, and Dr. Lundy, who we work with, if sexual health is a priority for them. And then similarly with research, we can sort of dial up or dial down based on their interest in pursuing research endeavors. So it's sort of a moldable curriculum.
That's excellent. Dr. Bole, I know we're only a few months in, even though time is flying by, but what has your week looked like and how have you been splitting your time between fertility, andrology, sexual health?
Yeah, and I know that we had these conversations when we first met on the interview about what was important to us when we were looking for fellowships. I would say that this fellowship is exactly as was built to me and exactly what I wanted, in that it is a very good balance, as Dr. Vij said, between infertility and sexual medicine, which is really important to me. So I spend about 2 days in the OR, 2 days in clinic in a week. And then I have a flex day, which really, depending on the fellow, could be used, for more OR cases, could be used for research as well. So really a very high volume of operative cases and clinic as well, to learn, why we're doing the surgeries that we're doing, which is extremely important in this space. And then with regards to research, this fellowship is a clinical fellowship, but we do have the opportunity to tailor some of our time for research depending on the interests of the specific fellow. Here at the Cleveland Clinic, we have a very productive andrology lab and a lot of different mechanisms for getting research funding and support for research endeavors. So there's time that you can carve out for that as well.
That's excellent. And I'll just give the listeners a little bit of perspective. At UCLA right now, my week sounds very similar to yours, Dr. Bole. I have 3 days of clinic, 2 days of OR, Wednesday and Friday. And then while there's not carved in or built in time, as this is also a clinical fellowship, we do work with research residents and research medical students interested in either andrology or male infertility. So the opportunity to jump into projects exists. I will mention, and I'd love to hear your perspectives, especially Dr. Bole, since we recently went through the interview process, but I think it is really interesting that folks interested in andrology and male infertility can kind of find the fellowship that meets their needs and their interests. I found it amazing, really, going through the interview process, even as it pivoted to virtual, how you could explore these different aspects of professional growth. For example, Utah has opportunities for entrepreneurship through Vault. Stanford has opportunities where the fellows in the past have worked on device design. The University of Miami has doing a lot of cutting edge COVID-19 research. Cleveland Clinic, of course, very well known in the research world. And so I just encourage the listeners, whether you're at a student or at the resident level, to know that this is not a standardized fellowship in any way, shape, or form. And really, you're going to get a little bit of a different flavor and exposure at different institutions. And so coming into the application period with that mindset will allow you to find kind of the right place and the right fit for different individuals. Pivoting on that a little bit, Dr. Vij, I'd love your perspective. You help recruit the next leaders in the field, and you've been really focusing on the male fertility side. What do you find are the most satisfying parts of your job nowadays?
That's a great question. So I really do enjoy teaching, which is why I've continued to be involved in the fellowship, despite the fact that we've grown so much. And I play a role with the residents as well. I'm associate program director. So I do find it very gratifying, teaching trainees, both, clinical medicine and urology and surgery. So, and I think what's really nice about being in academics is every day is different for me. So I don't ever feel like I'm kind of just in this rut of clinic. My surgery days all look different. I might have a stone case. I might have a vasectomy reversal, penile implant, BPH case, hydrocele. There's just such variety in what we do in the operating room. And then in clinic, same thing. I mean, you talk to a 20-year-old who wants a vasectomy, and then you talk to a 60-year-old who wants a reversal, and then a 40-year-old who needs a penile implant. So it's just really variable. And, when you throw in research, again, there's every day, every week is different, and it just sort of keeps your mind sharp, and there's always new challenges.
Yeah, and I'll ask you the flip side of that before I turn to Dr. Bole. What have been some of the most challenging aspects of your job? What are some of the things that are unique to either andrology or male infertility that can be, make a day a little bit harder?
I think the biggest challenges in the infertility world is that despite us having tools to help some people, we can't offer them because of insurance coverage issues. And that's very frustrating when you have a way to potentially help someone and you can't do it because they can't afford it. And that's pretty unique to the fertility world. And I think similarly on the sexual medicine side, we can't always help everybody. And some patients, I think, sometimes have expectations that we cannot meet. And, I think I'm still learning every day how to have some difficult conversations with patients that maybe have unrealistic expectations, or maybe they're unhappy with their outcome.
Mm-hmm.
I think sort of navigating those conversations and not taking things personally and being able to sort of stand up and, keep delivering good care, I think is a challenge. And there's just, something about sexual medicine that's just very unique compared to other parts of, of healthcare.
Yeah.
So I think that's never gets easier. I think you learn new tools to navigate those conversations.
Yeah, that's a extremely helpful perspective, and something to always try to keep in mind, that even when there's a challenging situation in front of us, you still have to kind of turn the corner and help the next person. So developing tools for managing that is important early on. Dr. Bole, how about you? Anything else that both on the satisfying aspect of this fellowship and this career that we're both pursuing, and also some of the challenges that you've seen already as a fellow?
Yeah, absolutely. I think being at a high volume center, I know you've seen this at UCLA with Dr. Mills, and I certainly see this in clinic as well, is that you tend to get a lot of patients who have been referred from other facilities, and you're their last hope. They're a tough case. There have been other people who haven't necessarily been able to help them. And sometimes you can, and that's really gratifying. And as Dr. Vich said, sometimes you can't, and that's a difficult conversation to have. Has there been anything in particular that stuck out to you in the last few months as you've been starting?
Yeah, no, thank you for flipping the script back on me. I was talking with my co-fellow, Jeff Morrison from Colorado, and I think the situations where, we do our guideline-driven care, get genetic testing, and you actually get one of those genetic tests where you have to tell somebody that, they don't have, even without financial considerations, that they don't have a chance of having a biological child. Those can be kind of heart-crushing scenarios. And sitting down with somebody and having their, the husband and wife or the partners together in clinic and sharing those news can be as hard as some of the cancer delivering news that I did as a resident. So I think I always knew that, but then actually being the person who's had to deliver results firsthand to somebody and to a couple, it really showed that that's a tough situation to be in. And so in everything that we do, or anybody that any part of urology that our trainees are going to pursue, you're going to have those situations that bring you immense joy, but also those really challenging clinical scenarios. That's whether it's for lack of insurance coverage, lack of medical tools, or lack of a answer where medicine can't even answer the question of why is this going on, doc. There's these challenges that we have to just kind of learn to overcome, and even when we can't fix it, be there as a support system for those patients and their families. Pivoting a little bit here, Dr. Bole, if you don't mind starting on this one for future, colleagues of ours, what does the process of applying to Andrology and Infertility Fellowship look like? What were the things that you did to get to this point?
Absolutely. And this is kind of an interesting question because I know it's been evolving, and Dr. Vich probably has some of the sort of latest updates on what this process will look like this year. But for people applying, the AUA created the formal Andrology Fellowship match, I believe, in 2007, but programs haven't always consistently participated in that match. And again, I think there are potentially some updates to that coming forth. So it's important to know, for applicants that, this fellowship is not an ACGME accredited fellowship, unlike, pediatric urology or FPMRS, and it's not coordinated by a single professional society like you would have for GERS and Recon or SUO and oncology. So we have the SMSNA, which is the Sexual Medicine Society of North America, and we have the SSMR, the Society for the Study of Male Reproduction, but they each sort of separately endorse programs. And then there's the AUA match. So it's a little bit difficult for an applicant to kind of figure out, which programs are available, which ones are through the match, which society endorses which. And Dr. Vich can probably speak a little to the process as it's going to be coming up this year and years going forth.
Perfect. I love that update for the listeners.
Yeah. So I think for the most part, the process is going to just be cleaner this year. And the goal is to sort of have it mirror the other, I think, more formalized, cleaner matches like SUO, even the urology residency match, which most of our listeners have gone through. And I think what's uniquely different about us and why we can't exactly be just like the SUO, for instance, is what Dr. Bole mentioned, is we are not sort of run by a single society. And there are fellowships within the andrology world that are 100% fertility and fellowships that are 100% sexual medicine. And the applicant pool tends to look at both. I think most fellowships now are a combination, but so it's a little bit of a challenge to come up with a perfect solution. But I think in general, applications tend to come in the fall, sort of through the end of the calendar year. And then the interview season is going to be more defined this year, essentially the first 3 months of the new year, January to March. And then programs will have a little more incentive to participate in the match so that we don't have as many programs going outside the match, which can both benefit and hurt programs and applicants. So just to, again, sort of try to clean it up a little bit. And then there'll be a formal match day like there have in previous years where, programs and applicants are notified of the outcome.
That's excellent. And there's a lot of ongoing changes. Is it still really going to be mostly on the applicants to look up the different institutions kind of highlighted by SSMR, SMSNA, at least for the time being? Is that correct?
Correct. And I believe that AUA runs the match, and it's going to be a little more clear which programs are participating in the match, because there is going to, again, be some incentive for programs to participate, things like a certificate of completion, mentorship opportunities for the fellows that go through the programs in the match. Again, some of this is still being formalized, so don't hold me exactly to those details, but it will be clear which programs are participating in that formal process. And those programs are then sort of bound to participate, meaning they can't do a late exit and take somebody outside the match. So I think it'll be better for everybody with the new process.
Yeah, no, that's excellent. I'm glad that, in addition to just hearing a little bit about the world of andrology and male infertility, listeners can actually kind of get a live update as to what is changing actively in the process right now for the fellowship match. So this was perfect timing. Well, one of our final questions, and Dr. Bole, you can take this one first as well. What is something that you hope changes or improves in the field of andrology and infertility going forward?
Well, I'm a little biased, as I guess, as are we all. I think it's a great field, but I think, the field in general seems to be growing. It seems to be becoming much more diverse and inclusive in the workforce, which I think is amazing. I think it's incredible to see, so many different types of people and leadership from so many different backgrounds. There's a lot of exciting research, of course, going on in, the world of male reproductive medicine and prosthetic device innovation. A lot of interesting things that people are doing. So, I think more of that is always welcome, and I'm excited to see what we develop in the years coming forward.
And what about you, Dr. Vidge?
I would say we just, in general, for both fields, sexual medicine and male infertility, we just need more treatment options. In the fertility world, we really have only so many tools in our toolbox, so to speak, to offer patients. And much of what we do is sort of off-label, not data-driven. And I think we just need more treatment options for men. And in the sexual medicine world, we have a lot of treatments for impotence, erectile dysfunction, but some of the other types of sexual dysfunction, like anorgasmia, premature ejaculation, we really don't. And a lot of what we try is sort of trial and error, not FDA approved, off-label. We don't have great data to sort of support when the patient says, well, what's likely this is going to help me? So I think as sexual health becomes a more normalized part of healthcare, I think, it'll drive more research support, funding support to help us be able to treat patients better.
Yeah, absolutely. And I think one of the other things that we can look forward to is if, the match is more formalized and centralized by the AUA, potentially that opens up more avenues too for collaboration across institutions. I know, for example, UCLA and Cleveland Clinic have been working on a joint database looking at things ranging from the use of clomiphene to an anastrozole for different male fertility indications. So kind of, can we work outside of our silos and get data that better applies to our patients? One of the things that's been on my mind as I went through the application process and during COVID, you kind of hinted at this at the beginning, Dr. Vij, but so much of male fertility care in particular can totally depend on insurance coverage and financial factors, not just what is right for the patient in front of us. And so I think seeing that some large employers across the country, tech companies competing, with each other in terms of benefits have started to support and cover fertility care. I think, it's kind of a little bit of silver lining, things that have come out of the pandemic, as well as the fact that so much of specialty care is regionalized into large cities and urban population centers. What can we learn from pivoting and using telehealth a lot during the pandemic to reach out and improve access to both sexual health and fertility care across the United States? So I think a lot of great progress and a lot of things to look forward to. Well, I think this has been a fantastic conversation. I don't know if you guys have any other closing thoughts or things that I didn't cover, but I hope that our listeners can take some nuggets of wisdom out of the talk today, and being able to hear from somebody who's established like Dr. Vij, and a fellowship director who helps recruit candidates, as well as two kind of younger folks in the field, Dr. Bole and myself, who are just a few months into fellowship and just excited to be a part of this area of urology.
And thank you for highlighting our field and giving it some attention and highlighting our fellowship. We appreciate it. And hopefully that we've inspired some folks to think about pursuing this subspecialty.
This has been an AUA Inside Tract podcast brought to you by the Residents and Fellows Committee. Check out the AUA University podcast for weekly episodes on the latest clinical updates and advances in urology. For more information about the AUA and membership, visit auanet.org.